no surprise that healthcare can sometimes seem overwhelming or confusing, but it's a lot less overwhelming and easier to follow your care plan if you understand the health information and services that your healthcare provider discusses with you. Pennsylvania's hospital community has partnered with Pennsylvania's libraries to hold Engage for Health programs in libraries across the state. It's a partnership that's a relatively new concept across the nation. Pennsylvania hospitals are trusted community resources for health and health information, and libraries are trusted community resources that connect individuals to information, so this partnership just makes sense. Hospitals and libraries across Pennsylvania are connecting to provide this unique program and help individuals take an active role in their health care.
Hi, I'm Dr. Michael Consuelos. How will you and your healthcare team communicate with each other is one of the most important parts of having good health care. Taking an active role in your health by listening to your care provider, making sure you understand what they're saying, and asking questions when you have them can improve your health and your care. Thanks for joining me and welcome to Engage for Health. You have a front row seat to this new education program to help you take an active role in your care. Take a look.
We're in Hershey, Pennsylvania at the Hershey Public Library to learn more about taking an active role in your health.
I am here because as I'm getting older, I have more doctor's appointments that seem to be filling up my calendar. And at times, most times I'm there on my own without my husband or somebody else, and I need to be prepared with my questions and health concerns.
Well, I came here so that I can find out more about health literacy, and I really feel that this is a way for patients to empower themselves. So I wanted to hear more about what's going on here and in the community and what I can do to empower myself as well.
Good evening. I'm Barbara Ellis, the director of the Hershey Public Library, and I'd like to welcome you here this evening. Thank you so much for taking this time to come and be part of this program. The special program that we have tonight is called the Engage for Health. This program came about as a collaboration between the Pennsylvania Library Association and the National Network of Libraries of Medicine and the Hospital and Health System Association of Pennsylvania. Tonight's presenters are Lydia Collins, who's a consumer health coordinator from the National Network of Libraries of Medicine, and many of you know Dr. Dwight Davis, right here in Hershey, professor of medicine, heart failure services, director of cardiac rehabilitation program, and Penn State College of Medicine. Now, Engage for Health.
Good evening, and thank you for being here today. So, today's program is called Engage for Health, and the reason for that is we want to really reinforce the fact that in order for you to have a successful interaction with your healthcare providers, you need to be an engaged patient. So what does it mean to be engaged? It means that you walk into a doctor's office and you sit there and usually they talk to you, right? You go in with a health concern, or you go in for a checkup, or perhaps you've got questions about the medication that you're taking. So when you prepare for the appointment, it's very important for you to know exactly what is it that I need to ask my healthcare provider, what types of things do I need to change, and really listen to the responses that the doctor gives to you. One of the other things is that beyond the listening skills, you really have to think about how much of what my doctor has actually said to me do I understand? And that's where it gets a little more difficult. We want to make sure that you leave here today with some tips and some ideas on how to make these interactions, because all of us have to go to a doctor at some point, right? Whether it's a wellness checkup or whether we have a chronic illness condition or need to check on some health concern that we might have. And so when you go to the doctor's office, how many of you, just by a show of hands, are comfortable and ask as many questions as you want to? So we've got some of you, about half the room, that's good. And there's some of us like me who, as a medical librarian, I still walk in nervous about what types of things that I should be asking to make sure that I receive the best care possible. So one of the things that you want to do is make sure that you ask the questions, ask as many as you need, so that you get the responses that the doctor needs in order to give you the best care possible. We know that when you walk into a doctor's appointment and you ask questions and they're able to provide that interaction, that you will give them the information that they need to be able to make an informed decision about your care. And when it comes to your health care, think about it. When you walk into a department shop and you go to purchase, say, a major appliance, has everyone purchased an appliance at some point? When you go in and you purchase that appliance, what do? Do you just pick up the first one or just say, well, this one's on sale, so I'll take it? A salesperson comes to you. You ask lots of questions, right? So if you're asking questions about money that you're about to invest in an appliance in your home, why not make that same investment about the health of yourself or your loved one?
Being engaged in your health simply means being an active participant by listening to your provider, making sure you understand what is being said, and asking as many questions as you need.
So a few tips to how can you stay engaged and what that really means. So when you go to the doctor's office, how many of you take someone with you? I see no hands. That's one of the things that you can actually do. Think about taking someone with you simply because that person can serve as that extra listening ear that you need in case you didn't quite hear something. That person can also ask additional follow-up questions because you may have mentioned to whomever you're taking in the office with you that, over the past few weeks I've been getting these headaches about an hour after I take my medication. Or it could be that you find that the different diet that the doctor's given you is not quite agreeing with you. And sometimes when you go into the office, you're so nervous that you forget to ask those particular questions. So having had that dialogue with someone else and bringing them with you allows you to engage with the doctor. The other suggestion is to simply write things down. Like, how many of you do well writing things down? If I don't write it, it no longer exists in my life. Writing things down before you actually get to the doctor's appointment. If you can write down what your health concerns are, whether it's medication, whether it's a different type of ailment or some kind of symptom that you're experiencing, write that down. And then when you get to the doctor's office, you have that with you. And the other thing is, if you have more than, say, 3 things that you'd like to discuss, we always suggest that you highlight the top 3. So pinpoint, what are the things that I must know before I leave my doctor's office? The other piece is this. If you have someone with you, you can focus on actually answering the questions and asking questions of your healthcare provider while your friend or family member keeps track and writes everything down for you. So that makes it a lot easier for you to have that conversation with your provider. The other thing we suggest is repeat what you've heard. I have a 10-year-old daughter, and I often give lots of instructions, and only half of what I say actually gets done. And so I have come into the practice of, Mommy has asked you to do X, Y, and Z. What did Mommy ask you to do? Usually I only get X, and probably Z she didn't want to do anyway. But when you get into the habit of actually doing that interaction and saying, okay, doctor, you're telling me that my medication needs to be taken twice a day with a meal, and you suggest in the morning with breakfast and in the evening with my dinner, and the doctor will repeat, yes, that is what I said. Then you know for sure you could write that down or have your person with you to write that down for you to reinforce the information that you're being given. The other thing we say, ask questions. And it's not always easy to ask questions. We know that you sit there and perhaps it's an appointment where you are given a recent diagnosis or the results of an exam. So you can't always think of that question to ask in the moment. But your healthcare provider will usually say, What questions do you have for me today? And that is your opportunity to go ahead and ask the questions that you have. And ask as many as you need. Write down additional questions that if you didn't get to, that you can send to your doctor or perhaps speak to a nurse in the office for. And make sure that you leave that office with an understanding of exactly what you need to make sure that your healthcare or the healthcare of the loved one that you're with is going to have the results that you need, which is to maintain your health.
Here are some tips. Consider taking a friend or family member with you to a healthcare visit. Write things down, repeat back what you've heard, and ask as many questions as you need.
HealthyMePA provides the information you need, from choosing the right physician and healthcare provider to understanding your healthcare coverage. HealthyMePA helps you manage chronic health conditions like arthritis, heart disease, and diabetes, giving you the tools you need to take charge of your health. Real stories, real people, real help. Get started today. HealthyMePA.com and on Facebook and Twitter.
I'm a cardiologist, and I have this great privilege of taking care of patients who have a whole spectrum of disease. And one of the things that has become increasingly important to me and to my practice is the fact that it's really a two-way street. The patient is in partnership with the physician, and that means that as you are engaging your physician with just a regular visit, or if it's something emergent, there needs to be a line of communication. And that communication involves information being given to the patient, but also the patient responding to that information, typically with questions and clarity. This is a part of the program where we talk a little bit about, if you will, categories of types of things that you want to keep in mind as you are having conversations with your physician. So here we have three kind of groups of questions, and there are probably more than this that you might want to think of yourself. The first is this what question, and that is, what is the disease process? What is the test that the physician wants you to take? What's the medication that he wants to put you on? The second is probably just as important, is the why. You know, when I was in medical school, physicians had conversations with patients, and back in the days of the dinosaur, they oftentimes didn't ever raise their hand and ask the physician, so why are we doing this, and what are the options? That's very important now. And you need, as a patient, to really understand why things are being done and for what reason and where this is leading to. The last on this slide, but there are probably others, is how. And you know, there's a lot of vagaries in our conversations oftentimes with patients. You know, we say, take a little of this and do a little bit of exercise is a classic example. Well, what does that mean? Does that mean, you know, 1 day a week? Does it mean 3 days a week? How long should I be doing it? So this is a short collection, if you will, of questions that I want you all to think about as you're communicating with your physician, and repeat them back sometimes, just to be sure that, you know, you have a sounding board, and particularly if someone else comes to an appointment with you, that the two of you can have this exchange.
The three main types of questions you may want to ask are what questions, why questions, and how questions. Now, let's take a look at what a medical appointment could look like when you take an active role in your care.
Mr. Jones, I understand that you're having some problems with the CHF that we diagnosed a few weeks ago. Can you tell me what's going on?
Well, I took those pills that you gave me last time, but sometimes I just forget to take them. Oh, and that diet you gave me, I hate it. Oh my goodness. Why can't I have my potato chips and my bacon?
Mr. Jones, let me just tell you that, you know, from my examination, I can see that you've got more fluid that you're carrying in your ankles. Your blood pressure is getting out of control. You've got extra sounds on your lungs. Do you understand the importance of a low sodium diet? Maybe you can kind of tell me a little bit about why it is that we ask you to eat a low sodium diet, and maybe after that you can tell me, you know, why it is we wanted you to take that pill. You know, I need you to understand the importance of these things, and you know, we spent some time going over that at your last visit.
I remember all of that, but you know, I left here. I didn't understand everything you said. For example, that diuretic. I know that's the pill, but do I have to take one every day? And low sodium, does that mean just I cut back on my salt? And then you said that I had CHF, and I had no idea what that was until I went home and looked it up on the internet. Heart failure?
Yes.
I mean, that scares me.
So it sounds like we should have been a little bit more specific at your last visit when we had this conversation. So CHF is congestive heart failure. It is a serious disease, but most patients can live with it if they follow a treatment plan. You can kind of think of it as a way in which it can help to modulate, if you will, symptoms and allow you to feel better. We want you to eat a low sodium diet, and we also want you to take that diuretic pill every day, and what that does is it flushes out the extra fluid and allows you to feel and to breathe better.
Okay, so what I understand is that my heart is working real hard, and sometimes it causes me to breathe heavy. And the extra fluid in my body causes my ankles to swell. I get that. I think I can do that. And therefore, if I take my pill and I eat a low sodium diet, I'll be better, right?
Well, I want you to call us when a couple things happen. One is when you gain a lot of weight, and two, when you notice that your breathing is heavier than usual. Those are the two things that I want you to kind of keep in mind in terms of our communication.
Okay.
And as long as you're working towards taking your diuretic as we want you to take it, and also being careful of the sodium in your diet, then I'm hoping that these things will settle out for you.
Okay, good. So you want me to take my pills, to eat a low sodium diet, and to weigh myself. And if anything happens, I'm to call you.
That's correct.
Very good.
So what I'd like for you to do is, now that we've had a chance to talk a little bit about this and you've got a little bit better feeling for it, maybe let's have you come back and see me in 2 weeks.
Okay.
Let's see how things are going over that period of time, and then we'll take things from there moving forward.
Thank you so much, Doctor.
Okay.
I appreciate that.
I hope this helps.
It did.
Good.
So, what did you see?
Notice that both of us had a problem here, didn't we? Because maybe you didn't pick up on this, but in that previous meeting, you know, I gave him some instructions, I gave him some abbreviations, and I didn't fully explain the specifics of what needed to happen. You know, we throw around this alphabet soup all too often, and this whole business about CHF, meaning heart failure. He had no idea about the serious nature of it, and he clearly left that first visit not understanding, the two pillars of his treatment. One was that he really had to eat a low sodium diet. You didn't hear me go over it here, but you need to ask, so what is a low sodium diet? So, the so-called water pill, patients oftentimes don't understand that when the heart's not working well, the kidneys have a difficult time getting rid of fluid. And that's why, one, we want the sodium intake to be low, and two, why we need to give that fluid pill, the diuretic, if you will, to help kind of get rid of that excess fluid. So keep those things in mind. These are just two simple examples of miscommunications, lack of good communication on the part of the physician, but also a lack of the patient really shaking their head, indicating that they understand what instructions are being given, but quite frankly, didn't understand those very well.
HealthyMePA shares simple, easy-to-do exercises, delicious recipes, and tips on managing health risks that impact you and your family to help you get the most out of life. Real stories, real people, real health. Get started today. HealthyMePA.com and on Facebook and Twitter.
In our digital age, it's critical for people to find and use high-quality digital information about their own health and the health of their communities. This is important for several reasons. One of them is that the internet has allowed the openness of information for everyone, from everyone, and so it's important to be able to sift through to find the most relevant, most actionable information for you. The National Library of Medicine provides such a service through our different portals on the web, Medline Plus in particular, that allows people to look at health information that has already been vetted or curated by experts.
What we'd like to do is focus on teaching you about some of the resources that are available for you to locate health information. So the National Library of Medicine produces a variety of resources that you can access online. These resources are all available at no cost and are reliable and provide you with good health information. The first one that I want to talk about is Medline Plus. Medline Plus is wonderful because it's produced by the National Library of Medicine, and you will notice, for those of you who have used it, there are no advertisements to any pharmaceutical companies or any medical device companies. The reason for that is we want to get you to good information so that you can make an informed decision about your health care without those extra distractions. Medline Plus has over 950 health topics, and they range in a variety of things. There's information on diseases and conditions. You can find health news. You can find information about drugs and supplements. And there are even health videos and tutorials on how to use online health information. We think that it's important to provide you with the information, but also to teach you how to use it and evaluate so that you know the information you're getting is the best information possible. Within Medline Plus, there is a specific health topic page that focuses on talking with your doctor. And that will lead you to the information that you saw today earlier from the Agency for Healthcare Research and Quality, as well as other resources that will provide you with information on what to do to prepare for your doctor, how to even choose a doctor. Within the Medline Plus Talking to Your Doctor section, I also want to point out, for those of you who have teenage grandchildren or children, there is a section that gives you information specifically for teens. Think about how important it is for us to engage in these conversations with our youth as they begin to age out and go into medical appointments without us parents. Another resource we have is called NIH Senior Health. So Medline Plus has a lot of information in it. And when we did some testing with the website, our seniors said, this is great, it's got good information, but it has more information than I need at this stage in my life. And so this resource provides you with specific content for seniors and aging adults. All of our resources don't focus just on, I have a chronic illness, I have a chronic disease. It focuses on wellness and prevention and what you can do to maintain a healthy lifestyle. This resource also includes a Talking with Your Doctor page. The Talking to Your Doctor page was actually designed to give you tips on what do you do when you go into the appointment, once again preparing, but asking some of those more difficult questions as things change as you go across the life spectrum.
Next time you're looking for reliable health information, check out medlineplus.gov and NIHseniorhealth.gov. These websites provide information about diseases, conditions, and wellness issues in language that you can understand.
So at this point, thank you all so much for coming. We hope that you had some information that you will find useful and share with your loved ones.
So you are now all teachers
There you go, you heard it.
of health care. So be sure that when you go home, you tell your neighbors that you have now been involved in the dissemination of information for the improvement of the health of your communities. You should all feel good about that.
Be very proud. Give yourselves a round of applause.
Thank you so much for coming out and spending time with us.
Thank you so much.
Well, thank you very much, everyone, for being here this evening. There are computers set up in the next room, as I mentioned earlier. If you'd like to look at Medline Plus or any of the other resources that Lydia made note of, and certainly please do be in touch with us as librarians if there's a question that comes up that we can help you with. Thank you for your evaluations and thank you for your presence this evening. We appreciate it and have a good evening.
Taking an active role in your health is important for you to receive the best care possible. Open and honest communication with your healthcare team will help you both make good decisions about your care. Now it's your turn. During your next medical appointment, engage in your own health. Bring along a friend or family member, write things down, repeat back what you heard, and ask as many questions as you need. To find an Engage for Health program in your community, contact your local library or hospital. Thanks for joining me.